I mean, I guess you all have the handouts. I think unfortunately we can't project slides, but you all have handouts, and we can go over each slide. I mean, we have some time constraints, so we can try to get as much as we can in whatever time we have. So, what is the culture of health? And I mean, based on the AHA, and the American Heart Association, there are certain things on slide 3 is the mission for the American Heart Association. And the top priority is the living healthy heart and healthy lifestyle. And heart disease is number one killer, causing more than 40% of all deaths, and more than, the combined next 4 causes of death. Stroke is at number 5. So, I mean, we always worry about the heart. And nearly 60,000 people in New York die from cardiovascular disease each year. So, why does it matter? I mean, the first time in last 10 years, we are seeing that the death from the heart disease and the stroke are highly rising. And, okay. Sure. Okay. So, we can go over a few things to see how we can reduce the cardiovascular, the death and the risk, and how we can increase the healthy lifestyle. So that's me, and so there are basically 7 steps, and we can go one each at a time. But before that, I mean, as I said earlier, that the heart disease is number 1 cause of death. Stroke is at number 5, and combined together, I mean, they are very concerning. Again, 42% of our adults in the the United States are overweight. About 17% children are overweight. 17% adults smoke tobacco. More than 20% of the adults having no physical activity in last month. So I mean, those are all very concerning, and that can lead to the cardiovascular disease, and we can see how we can prevent that. More than 27% have high blood pressure, 40% of them have cholesterol, and about 8% of them have diabetes. So heart disease and stroke can be prevented 80% of the time by making some healthy choice. And what are those choices that we can go over? So the slide simple 7, that's the American Heart Association's the motto. And what are those 7 things? Stop smoking, eat healthy and eat better, get active, do some exercise every day, losing weight if you are obese, managing the blood pressure, cholesterol, and diabetes. Those are very 3 key important aspects of being healthy. Number 1 is the smoking. Don't smoke. I mean, it's very important. And quitting smoking, it has an immediate health benefit. And only within 20 minutes of stop smoking, your blood pressure and heart rate will come down to non-smoker. Basically, when you smoke, the nicotine can increase your heart rate and blood pressure. So when you stop, I mean, it will immediately come down. The eat better, right? What are the healthy food? Fruits and vegetables, whole grain, low fatty dairy products, skinless poultry and fish, nuts and legumes, vegetable oil, non-tropical vegetable oil, and lean meat. And we try not to eat or eat less of saturated fat, trans fat, sodium, fatty, sweets, and sugary drink. So any kind of vegetables are good. I mean, roasting veggies rather than frying them or caramelize them. That's better. And if you go to American Heart Association website, I mean, you can get the healthy heart recipes as well. So that's also very helpful. Serving size is also very important. So 12 ounce of meat is actually 4 serving size. So I mean, those who now steak, the meat, I mean, they have to be careful what they eat. So size is very important. Again, if you're looking at the food and the drinks, what to drink and what not to drink. I mean, right? I mean, we know that it used to be like red wine is good for health. Yes, anything in moderation, but drinking heavily is not good either. The fruits and vegetables are good. Again, get active, right? The activity, weight loss and activity go together. If you are active and exercise regularly, you maintain your weight and healthy lifestyle. And you gotta break the exercise whichever way you like, but I mean, ideally in multiple sessions, maybe 10 to 15 minutes per day, or if your activity level is high, then multiple times a day. So, I mean, what are the recommendations from American Heart Association for the exercise? It's 150 minutes of exercise, which is what, about 30 minutes a day, 5 days a week. And what are the moderate exercise, which is like, the walking at a good pace where, your heart rate goes up, you start to sweat at the end of your, the exercise or walking. But you can carry out conversation, you can talk, you can breathe a little bit heavier, but I mean, there is no, the distress. That's moderate exercise. And there are vigorous exercise, which are 75 minutes per day, per week, which is 25 minutes, per day exercise, and where you can jog or run, and your heart rate go much faster. You can still carry out some conversation, but with slight difficulty in breathing. So, those are the exercise recommendation from American Heart Association. Also, you can break out in those 30 minute per day session into multiple session per day, in 10-minute session, like walking the dog or going to the mailbox, or just walking around the complex. I mean, you can choose whichever way you want. But I think the idea behind is to do some sort of activity, exercise, and on a daily basis, 5 days a week. So again, the other aspect of those three most important things are the controlling the blood pressure, controlling the cholesterol, and maintaining the blood sugar. Or if you are diabetic, managing the sugar, and hemoglobin A1C. That's one of the blood tests that we check to see how bad is your diabetes. So, what are the definition of the high blood pressure? The normal high blood pressure is less than 120 systolic, which is upper. If someone who's taking the blood pressure home at your home monitor, there are two numbers comes up, the top number and the bottom number. Bottom number should be less than 80, top should be less than 120. That's the normal. The elevated blood pressure is between 120 and 129 on the top, and at the bottom it should be less than 80. Then there are stage 1, which is high blood pressure, mild, one can say that, between 130 and 140, at bottom number is between 80 and 89. And then stage 2 is moderate high blood pressure, so top number is more than 140, the bottom number is more than 90. And someone who needs immediate attention if their blood pressure is systolic, which is top number is more than 180, and the bottom number is more than 120. Those patients really needs attention right away, perhaps needs to start on blood pressure medicine to control it better. So what are those number means? As I mentioned, the top number is called systolic blood pressure. That's your heartbeat and force the blood into the arteries when the heart squeezes. And the bottom number is that when the heart relaxes between two beats, where the blood comes back inside the heart and heart relaxes. What can blood pressure do, or what happens when you have high blood pressure, and what are the risks and consequences? There are stroke, vision loss, heart failure, heart attack, kidney problems, sexual dysfunctions. There are a whole host of complications when you have high blood pressure. So it's very important to control the blood pressure. One step next, which is what are the signs of the heart attack, which are very important, because many times we tend to ignore. And especially in women, the signs are a little bit different than with men. We feel like, the chest pressure, discomfort, very heavy breathing, cold sweats, those are the common signs. But again, in women, the symptoms may be different, like nausea and vomiting, lightheaded, neck or jaw or tooth pain, shoulder pain, back pain. But something unusual which you're not feeling commonly. And when you are sick, I think you need to seek the medical attention to make sure that you're not dealing with anything serious. There are 4 signs or 4, the nomenclature that we use called FAST those are the warning signs for the stroke, which is facial numbness, weakness or drooping, or drooling, one can say. So those the facial expression when you have weakness, can't able to talk, or maybe when you talk your words are a little bit slurred, which is S, difficulty speaking. and you have the weakness in the arm, can't lift or hold the coffee cup or hold the mug, or you can't hold up your hand. This is A. And T is the time, which is very important, to call the 911. And immediately, if you see those kind of symptoms, you need to call the ambulance or 911, or go to the nearest hospital or emergency room to seek further medical care. So, what are the new health epidemics? I mean, again, that's the chronic stress. I mean, we all have stress, some sort of others, but how to deal with that? I mean, as per World Health Organization, I mean, they have come up with this, new health epidemic of 21st century, which is chronic stress. I mean, so emergency stress stoppers are in actions to help diffuse stress at the time of the moment. I mean, not everybody has, one option. So, there are multiple things. If you can look at the slides, very important that, if you are in stressful situation, what you need to do to just calm yourself down. I mean, you can count 10, before you speak or react. I mean, many a time we tend to react right away in those situations, but I mean, sometimes it's not good, sometimes maybe harmful to yourself or to the opposite person. I mean, take a few slow, deep breaths, maybe, take a walk, just go outside and, just relax. I mean, a quick meditation or prayer if you are believing that. I mean, all those will helpful. I mean, to just, suppress or, the stress. I mean, if something not urgent, you can, sleep on it, respond it tomorrow, especially if you are, at workplace, you need to respond via email or whatnot or social media. You can just, just take it easy, sleep tonight, breathing in the morning and see what's going on. Or, work it out. I mean, do some exercise or activity, as I mentioned earlier, go for a walk to reduce those stresses. So again, I'll go through a few things. What is the healthy heart, or is it your heart is healthy kind of things? What to eat, what not to eat. I mean, coconut oil, it's not recommended. We used to have, I mean, in the past that it's good, but it's not anymore. Some of the fats are healthy, but not all. E-cigarette, I mean, we all know that it's quite a bit in the news that whether those who are smokers started doing e-cigarettes to either eliminate the urge for smoke, but again, e-cigarettes tend to be harmful. It's not good. I mean, we know that there are multiple issues, especially the flavored e-cigarette. I'm not the guider. So, there are certain statistics that, we know about the e-cigarette and the smoking. Of course, the sleep is very important, right? I mean, ideally, it says that you have to have 6 to 8 hours of good night's sleep. So, sleep is very important. If you are not sleeping well, next day you will be tired, you can have 8 times sleep, you may have, again, the sleeping is directly correlated with the high blood pressure if you have not slept enough for multiple days. Regular sleep, again, as I said, is very healthy. Fresh vegetables are better than frozen vegetables. Good oral hygiene is also very important for a healthy heart. Eating, good quality food is important, not the fast food. The whole grain is important than the wheat or the rice. And everything is moderation, like whether it's the table salt, sea salt, kosher salt. I mean, we always say that less salt diet. Those who are hypertensive or those who have heart failure. I mean, the less salt meaning it's in moderation. I mean, always we tend to we like to say that don't eat anything on the table. Just use little bit in the cooking, which is okay. So again, I mean, those are the simple 7, which includes stop smoking if someone is smoking, eating healthy vegetables, fruits, exercise, and be active. And 3 most important thing is cholesterol, blood pressure, and diabetes, and of course, losing weight and exercise. So those are important things to achieving ideal cardiovascular health and